We're going to talk about diabetes and the implications of diabetes and the complications of it. Diabetes has become an epidemic in the US. And the analogy that I have for diabetes and prediabetes is looking at an iceberg. And what you see on the top of the iceberg is the top of it is what you see on the water level, but underneath it is a whole bit of the iceberg which we do not see. So prediabetes is the part of the iceberg which is hidden under the water, and diabetes is the part of the iceberg that we see on the top. The numbers that we have currently on diabetes is about 30 million, greater than 30 million Americans, which is close to 9% of the adult population has diabetes. And for prediabetes, it's a little greater than 84 million people. Out of the 84 million people with prediabetes, 9 out of 10 don't even know that they have it. And remember, prediabetes is considered diabetes that's not far along enough to be diagnosed as diabetes. And the fact that you have prediabetes doesn't mean that the complications have not started. And that's the insidious nature of diabetes, is that it starts the process in prediabetes. And the very good news is that we can do something about it. The good news is that diabetes is preventable, and we have the data to prove it. And it came in the form of a study, a landmark study known as the Diabetes Prevention Program. And this study was done in 1993. It was supposed to be a 4-year study, but it was cut short because the results were incredibly great. And the study went on for 3 years. And what they did was that they recruited people who were pre-diabetic, because we think that's the best stage to really prevent diabetes. So the study recruited over 3,200 people, starting from the age of 25. And they were divided into 3 different groups. The first group was known as the Lifestyle Modification Group. The second group used a medication used for treating diabetes called metformin. They used 850 milligrams of the medication for twice a day. And the third group was known as the placebo group, which is what we do in every clinical trials or any study. And at the end of the 3 years, what they found was that the people in the lifestyle modification group, which involved diet, low-calorie diet, low-fat diet, and 150 minutes of exercise per week, which is 30 minutes per day, and it involved walking. These people in the first group, known as the lifestyle group, lost 7% of their body weight. And the second group, which is the metformin group, the patients also went on. Not only did they lose weight, but they didn't go on to become diabetic. And overall, when the results were published, we found out that the people in the lifestyle intense group, close to 60% of them in the 3-year study did not go on to develop type 2 diabetes. The people that took metformin, 31% of them did not go on to develop type 2 diabetes. So the results tells us that type 2 diabetes is a preventable disease. That is the good news that we learned from this study, that diabetes, particularly type 2 diabetes, is preventable. Diet, exercise, and losing weight are the keys to the prevention of diabetes. Family history shouldn't become your destiny. You can actually prevent type 2 diabetes with these moderate changes in your lifestyle. You can make a change, and it should start today. And all you have to do is a healthy lifestyle and exercises.